Hi, I'm Virginia, and welcome to the Medical Writing Uncut podcast, where we talk about medical writers from all over the world. Here with me today is Leanne. Thank you so much for being here today.
Thanks for having me, Virginia.
Thank you so much. I recently attended your How to Write Simply workshop and also health literacy workshop as well, which were really, really insightful. And for the audience, Leanne is part of the regional health literacy team in the Northeast and North Cumbria. So, as part of the NHS team and educating everyone about the importance of health literacy and also making sure that health information is accessible so that patients can understand it, use it, and make decisions about their health with it.
Well,
So,
good.
thank you. So, I wanted to ask you, how did you get into your line of work?
Oh, so do you want the long story or the short story? No,
Either is fine.
well, so it's funny actually because I started off in dentistry and worked in dentistry for 10 years now, I think. Yeah, just over 10 years. Um, and I did various roles. So I was a dental nurse through and through, to be honest. And then moved on to delivering training to lots of different roles because the company that I worked for have their own training academy. So that's kind of how I got into delivering training. And then redundancies happened and I kind of thought, oh, what do I do? Do I stick with what I know or do I branch out and maybe look at something different? And so I suppose I got into this particular role by chance, in all honesty. It was not, it wasn't the plan. But yeah, I was in a position where I thought I could sit back and think, what do I want to do? What do I want to be a part of? And this job, I actually applied to two roles, similar but slightly different. And then when I got offered this one, I took this and have had my eyes opened massively. And I remember the someone that I used to work with saying, I think this will be one of the best things that happens. And at the time I thought, whatever. But actually, I could not agree more, in all honesty. So yeah, that's how I'm doing what I'm doing now, but started off training because I used to be a mentor for dental nurses that were new to the business and getting them through exams and stuff. And I just really enjoyed it. So I've kind of just gone from there, to be honest.
I love that. So you're you kind of found your super skill is naturally being good at teaching. So
Oh, thanks very much. But yeah, I think, do you know something though? I just really enjoyed it. And I think because, especially when there's something important to learn, regardless of what it is, I feel like I can get it across in lots of different ways so that the message lands to everybody, do you know? And I think, yeah, well, you've been on the sessions that I've ran for health literacy, and I feel that no question is a silly question when you're new to something, and I think that that's the approach that I've always taken. But yeah, I started off way back when in dentistry, so yeah.
that's really interesting. And so thank you for sharing that. I wanted to ask you if you would be happy to share kind of in a nutshell what health literacy is and why it's important.
Oh, I don't believe that I can speak in a nutshell, Virginia. Around the houses as we know, but to keep it short and simple, which is, what we tell people to do, health literacy is really, we ask this question in the sessions and people will say, well, it's about health information and it's being able to understand that health information and it is, but it's also being able to check it and use it so that people can make real informed decisions about their own healthcare, but not just that, but being involved in those decisions because a lot of the time, and again, I keep going back to dentistry because that's probably the first time I saw it without realizing it. But your patient will come out of the surgery and think, right, what's happening, what's wrong, and what am I coming back for? And you're having to kind of relay that information in a different way. So yeah, health literacy is being able to access, understand, check, and use information to make decisions about your health. And it's important because if you don't understand the information that's being given to you, regardless of who you are, then how can you really say that you know what's going on and the decisions that are being made, and how much you're really involved in that? So it's important that, we give information in a way that people can understand so that they're in charge of those decisions, essentially. So that's as small as my nutshell is. I know it's probably a bit more than you expected, but but yeah.
No, that was a great explanation. Thank you so much. And so, what would be your top tips for our audience, which is mainly medical writers? So,
Okay.
when they are trying to simplify information, do you have any kind of frameworks that they can use to check over their work if they're writing for a patient or public audience?
Yes, we do. We do actually. So, um, we, I'm all about giving little tools to add to what's in your box already, and I think that there is a lot to writing simply. It sounds simple to do, and the steps the very basic steps are, people sit and go, well, that's easy, that's simple. The principle is, what's difficult is changing your practice to do that day in, day out, because we learn to do things a certain way, and then, I come along and Tracy comes along and our editors come along and basically say, do the opposite of that. But the bit, the we say, talk to Betty. That's our little tool to give people. And we love an acronym in the NHS.
Yeah.
So Betty is basically for break your information down, use everyday words. And I think that's probably what people struggle with the most, to be honest, is the language change. And people, we've heard time and time again, I can't say that, I can't write that. But actually, you can. Like, it's okay. And if you look at the NHS A to Z guide for health writing, that's almost your permission slip to use that everyday language. Um, so yeah, break it down, everyday words, talk to a friend. So that's to do with your tone, that warm approach, and, really having that conversational approach to your writing. Take stuff out, because, we are very good at overwhelm. We will put everything in there, and really, and that for a lot of people is, it's too much. So it's, take stuff out, only include what is absolutely necessary, and then use you, we, and I. And that again is, changing from the medical professional will do this to we will do this. And if a person suffers from X, Y, and Z, if you suffer from this, that, and the other, it just again allows there to be some people in that, rather than it feeling a bit disconnected. So, yeah, Betty, break it down, everyday language, talk to a friend, take stuff out, and you, we, and I. That is what we ask people to. That's a very whistle stop tour, the very sort of simple principles of it. There is more to it, but yeah, if you can stick to that, keep that, in mind, you're onto a good start.
Brilliant. Thank you so much. That was really well explained. And it's a nice little framework that I hope people will take away from this podcast and actually go and use.
Thank you.
And and so I would also ask, as a final question, how do you think the impact of teaching your workshops is going to help people in the community with their health? So I think we also tend to forget that we communicate in lots of different ways, so like patient letters, emails,
Yeah.
it's not just leaflets and things. So even when I was in the workshop, you spoke about the signage. So if there's a sign to go somewhere, that sign needs to make sense as well. So do you want to talk about how some of the some of the takeaways from your workshop have inspired change in the region?
Yeah, and I think, in all honesty, the more sessions that we run, I think the awareness is the real big hook for a lot of people, because I think, because we work with healthcare, local authority, voluntary, so we work with a lot of professionals, people working right across different organizations, and I think people are genuinely shocked with the number of adults that struggle to understand words and numbers on a page. That are shocked about the average reading age being so low across the country. And I think that is what drives a lot of people to think, okay, we really need to do something about this. So we've had lots of people just focusing on one thing at a time. So, right, let's look at our letters first and foremost, because then if people know why they've got an appointment, then that might, help people to come, and or it might increase. So one of the examples we've got is we worked with a targeted lung health check team, and they were working on a few different things, but our team were looking at the invite letter for uptake of screening because they wanted to increase that. So it's definitely inspiring a lot of change, because I think the language that is used in a lot of information just puts people off if they don't understand it. Again, it goes back to, well, who's this for? Is this for me? Is it not for me? What's it about? Um, so we've had a lot of that. But yeah, we ask estates to think about your signs, because if your signs don't match the letters, then people will go home. Like, that genuinely does happen, and it really is working well. So there's been a lot of community engagement done in our local areas, and we take befores and afters of letters, of leaflets, and we work with the local people to make information that is for them, because if you include people that are on the receiving end, then you're much more likely to get it right, rather than just writing down what you believe is going to be useful for them. So yeah, there's been a lot of change. A lot of people on a writing perspective now looking at text messages that go out to patients. We've rewritten lots of leaflets. I say we, the other part of the team. So we have some editors on the team as well, and they are great. So they work with people quite closely to make these changes. So yeah, it's inspiring a lot, and I think the more we do it, the more people want it from us as well. And there's definitely a lot of people on board. So yeah.
Brilliant. I really love that. I love the work that you do, and it really kind of matches up to everything that I'm promoting. So, making sure that health information is accessible and people can really understand what's happening. And I
Yeah.
think you can get really vulnerable as well if you don't understand things, especially about your health. So the power is in your hands, medical writers, if you're watching or listening to this. So make sure you do your best.
It really
So
is.
thank
It really is. And I think, people will say, like, I didn't, of course, if people don't understand, it just puts, they may have to come back for another appointment. So I think, staff see the effect that it has, full circle. Of course, not understanding affects the individual, but it naturally is going to potentially affect the service as well. So yeah, it helps everybody involved.
Yeah, that's so true because otherwise, if something makes you stressed, it's really easy to just ignore it, but then that's what leads to your health getting worse, and then it becomes more difficult to treat the
Mhm.
situation as
Yeah,
well,
definitely.
depending on what it is. So, as healthcare professionals, your communication is part of your care as well.
Yeah, I agree.
Awesome. So, where can people learn more about you and what you do, and maybe attend a workshop, and who is it available for?
Okay, so learning more about me is I don't think people want to know more about me, but but about, us and what we do. We have so we are working as part of the Northeastern North Cumbria Integrated Care System. So we are on that website. We run monthly webinars for people that work across the ICS. So, or I should say integrated care system, if I'm going to practice what I preach. So yeah, we run awareness sessions and how to write simply sessions each month that you can book onto on Boost, which is the learning platform. And we also work a lot with teams on a bespoke basis. So usually someone will come to a session and then say, can you come and do this for my team? And what we then do is put a lot of their own information. So we'll say, give us some examples, because it is sometimes hard to spot the difficult words and the difficult sentences in your own work that you've created. So having that outside perspective can really, people go, oh yeah, like, yeah, I didn't think that was difficult, but actually now you've pointed it out, yes, I can see it, you know. Um, so yeah, that's, you know, you can find out about us and what we do on the website, but also you can book onto the sessions on Boost. So yeah, that's us really, I suppose.
Brilliant. I'll also link to your LinkedIn as well if people want to get in touch through that way. So,
Yeah.
so thank you so much, everyone, for watching or listening, and thank you very much, Leanne, again for coming to share your words of wisdom and the impact that you have as well.
Oh, thank you for having me, Virginia. It's lovely to chat to you.
All right, we'll see you at the next episode. Bye.
Bye.